welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or symptoms of heart disease. Cardiac emergencies can take place at any time and at any age. Sudden cardiac arrest and heart attack are such emergencies, and it has been proven that bystanders CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests take place at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists to help you understand sudden cardiac death and the role of CPR. We're joined by Dr. Harendra Dev Singh, Consultant Cardiologist, Associate Professor, Krishna Heart Care and Maternity Home, Jaunpur, Dr. Hiralal Pawar, Consultant Cardiologist and Diabetologist, Hridayakesha Heart and Eye Clinic in Nashik, and Dr. Vikramaditya Padhi, Interventional Cardiologist, Vikash Multi-Speciality Hospital and Gargi Polyclinic, Sambalpur, Odisha. Thank you so much, doctors, for joining us on the program. Dr. Padhi, first to you. Abnormalities of cardiac rhythm are prevalent. What is arrhythmia and how does arrhythmia affect daily life?
Arrhythmia, as the name suggests, it is an abnormal rhythm. The normal rhythm of the heart is it is regular and it beats at a rate of 60 to 100. Any abnormalities beyond this is called arrhythmia, and the faster heart rates are called tachycardias, and the slower heart rates are called bradyarrhythmias. And these can affect your activities of daily living if they are at an abnormal rate, and they can cause even sudden events also, like sudden cardiac arrest.
All right, Dr. Singh, now as we learned, heart rhythm disorders come from an issue with the cardiac electrical impulses that control the heartbeat. What are the symptoms of an arrhythmia?
We all know that all the arrhythmias don't have symptoms, but those have symptoms I classify into two groups. One is in urgent group, one is in emergent group. If someone is complaining that his heart is running too fast, and someone is complaining that his heart is running too low, and someone is complaining that heartbeats are skipping, it means it is urgency, that you take a appointment from the doctor and go and get thorough checkup of yourself and get treated. And if patient of arrhythmia have chest pain, tiredness, dyspnea, faintness, and history of syncope along with sweating and multiple complaints, then this is the emergency for the arrhythmia, and you urgently try to meet doctor and get evaluated and treated. Otherwise it will be dreaded for you.
Right. Dr. Pawar, how many kinds of heart rhythm disorders are there, and which arrhythmias, which is the most serious?
As already told that arrhythmias is irregular heartbeat. There are tachyarrhythmias and there are bradyarrhythmias. In tachyarrhythmias, there are atrial fibrillation, there are atrial flutter, there are supraventricular tachycardia and ventricular fibrillation. So ventricular fibrillation is the most dangerous arrhythmia because it has a rapid abnormal rhythm and can lead to sudden cardiac death. So this is most serious arrhythmia. Then there are other bradyarrhythmias like sick sinus syndrome, conduction blocks. So there are multiple types of arrhythmias. Thank you.
Right. Dr. Vikramaditya, how are heart rhythm issues then diagnosed, and can a pulse detect arrhythmia?
The best way to diagnose heart rhythm disorder is to do an ECG, but it is often not possible for everyone to have an access to ECG. So what can help is that, even patient's education can help. One can simply, even the patient or anybody who is, standing by them, they can just have a look at the pulse. If whether we can know that if it is abnormally high or low, if they are missing beats, whether it is regular or irregular, And many a times when if somebody has an established disease, we tell them also how to diagnose whether it is regular or irregular by simply just suppose I strike the table or something like that, just like this. If regular or irregular, we can educate them. And post COVID, many people have pulse oximeter at home also, and they can just put a pulse oximeter and know whether it is very fast, slow, or even regular, irregular. Everything can be known.
Right. Dr. Singh, can heart rhythm issues then be cured? If you could tell our viewers, what are the treatment options they have for this heart rhythm irregularity?
As there are so many things to prove that ablation therapy cures arrhythmia 95 to 98% for the certain arrhythmias. But other arrhythmias can be managed by pharmacologically, by decreasing the automaticity of the myocardium and decreasing the heart rate, as well as there are certain devices available with us, that pacemaker, defibrillator, combo of it, like ICDs and CRT. So with the help, and there are certain surgeries like mesh surgery we can do for the arrhythmias. By doing all these things like high frequency radio ablation, pharmacological therapy, and these devices and surgery will improve the quality of life of arrhythmia patients, as well as they will give a good quality of life and maintain the heart rate and the automaticity of the heart.
Right. Dr. Pawar, as we discussed, pacemakers treat people who have arrhythmias or problems with heart rate or rhythm. How does a pacemaker work, and what activities can one participate in after he or she gets a pacemaker implanted?
Basically, pacemaker is an artificial electrical signal that is produced in the heart by a battery, and there is one lead that is attached. So that pacemaker is doing its work by just giving electrical activity to the heart. So normally it is put for patients with complete heart block. Those patients have a lesser heart rate and they had a syncope, that is 2:1 heart blocks. So this patient will require pacemakers. So it's a basic small surgery which is done by cardiologist. And when that pacemaker is implanted to the patient, so that time we advise some instruction to the patients, particularly initially 1 month, that is very crucial. They have to be very precautious about their activities, because it's a surgery which can excessive movements can dislodge the battery and wire. So after 1 or 2 months, then patient can do routine activities like exercise as per doctor's advice. Then they can drive their car, they can travel, then they can return to their normal work if they are working in some companies or factories. Even they can work in their house. So they can participate in some sports and other recreational activities. They can shower, they can take baths. So they can have their normal activities most of the time. But there are some certain conditions we have to avoid. Particularly, we have to avoid going through the metal detectors, because metal detectors can produce some artifacts, and that can malfunction the pacemaker. So we have to avoid that. Then we have to avoid MRI. And nowadays there are MRI compatible pacemakers has been implanted most of the time. So you can safely go with MRI also. But yes, you have to inform that you have been implanted with pacemaker. So I think with pacemakers, you can do most of the activities, and it's like a normal life. You have to just conscious about your regular checkups and battery checkup. Thank you.
All right. Well, speaking of the batteries, Dr. Vikramaditya, how long does a pacemaker then last? It's an operation to implant it, and what happens when you do need that new battery?
Yeah, normally it depends actually, because in all patients who have been implanted a pacemaker, they don't require pacemaker all the time. It depends what is the frequency of or what is the percentage of pacing being done by the pacemaker, but on an average about 8 to 10 years. But if they are requiring say consistent pacing, that it may last for 5 to 7 years. But if it is intermittently required, then it may last for up to maybe 12 to 15 years also. And regarding the second question, Once the battery life expires, you can very well know and accurately know, when the pacemaker is to be replaced by regular or periodic interrogations. And the process of say replacement of the battery or the pulse generator that we call, thankfully is a relatively easier procedure compared to the index procedure when we implant it. And because the most important part is placement of the lead is already there. It is already in place. We just have to change the pulse generator. And many places we can do it in on an OPD basis also. And then we can discharge the patient. Or at best, it might take 24 to 48 hours.
All right, so that's important to know. We'll slip into a short break. We have many more questions to ask all the doctors, so do stay with us. Welcome back. You're watching Save a Life, and we're talking about heart health and arrhythmias. Let's return to our panel of doctors. And doctors saying which arrhythmia can cause sudden cardiac death, and what are the requirements of first aid in case of cardiac arrest?
Ventricular tachycardias and ventricular fibrillation and prolonged asystole is the most common cause of sudden cardiac deaths. And they are the dreaded arrhythmias in our setup. So whenever we come across to such kind of cases, we should see the responsiveness of the patient and make patient lying down on the board or any place and keep the legs up and give a good thump on his left side towards the lower side of the sternum and start CPR. And meanwhile, you have to seek help from emergency people, and if available, if defibrillator is available with you, you can deliver a shock even then, definitely at the same time. And you have to continue CPR. You know that CPR will help you to make patient to reach the hospital and get emergency help. So CPR is the important thing. You know that one thump and CPR and one delivery of shock will save the life of person. तो आप कहते हैं कि आप ये कह सकते हैं कि आप एक मारा गया मुक्का लेफ्ट साइड में और किसी को दिया गया CPR और एक जो है डिफिब्रिलेटर दिया गया, एक झटका आपकी जिंदगी बचा सकता है. Arrhythmias are very dreaded and CPR is very important, and CPR will save the lives. That's why CPR is so important in the cases of arrhythmias where there is chances of sudden cardiac deaths.
Right, that's important to know these sort of reactions and bystander reactions that can be taken. Dr. Pawar, what are the current guidelines for CPR in India? If you could explain that further.
CPR, as already told by Dr. Singh, it's an very important event in terms of cardiac arrest. When patient is basically cardiac arrest, we have to start immediately CPR, because the sooner you start CPR, the better the outcome. So you have to check the pulse, you have to check the respiration, and you have to start CPR. So initially push hard and fast. That is the rule. Pushing someone's heart at least 2 inches with each compression and allowing their chest to rise back up between. So that is basic concept of CPR, and your aim should be at least 100 or 120 compressions per minute. So that should be continued till your help is arrived and till your emergency team reach the point. So, and CPR should be continue. You can continue till 15, 20, 30 minutes. Even there are some studies, the longer CPR you continue, the brain outcome is good in these survivor patients. So start early and continue longer. So that should be the rule in CPR.
All right. Dr. Vikramaditya, we read a lot about antioxidants. How do these promote good heart health, and what are some of the foods that are highest in antioxidants?
Antioxidants, obviously we read a lot about it, and there are many products in the market also. But we are in an era of evidence-based medicine, and we go by trials, and they have suggested that supplemental antioxidants may not be that useful, and the best way to get antioxidants is by eating healthy diets, like you asked. What are the healthy diets? Diets which are rich in, say, fruits, vegetables, whole grains, and something like broccoli, carrot, tomato, potatoes. These are rich in antioxidants, and actually the best way to get antioxidation is by being active. Actually, you have to do regular physical exercise, at least 30 minutes a day, 30 to 45 minutes a day, at least 5 days a week, and yes, this is the best way to get antioxidants.
All right, Dr. Singh, shortness of breath can indicate various complications such as congestion, fever or asthma, but also sometimes heart problems. So how do we know if shortness of breath is due to a heart problem?
Shortness of breath related to hearts have certain things. If any shortness of breath related to exertion and relieves on rest, any kind of shortness of breath increases while sleeping down and it is improved on sitting or standing up, or any shortness of breath later in the night and it relieves on sitting or standing up, is more probability of shortness of breath due to cardiac origin. And if there is shortness of breath without productive cough, is also a sign of a cardiac problem. And if patient is having short history of hypertension, ISD, RSD, congenital heart disease, probably they are more associated with shortness of breath. So these things we can, this way we can make out that these things are related to heart or not. But by test, echocardiography and PFT test, we can make it very well that this shortness of breath is due to cardiac problem or something else.
All right, Dr. Pawar, if you could, tell us more about heart attacks and what are the kind of symptoms that one experiences, so that, viewers are more aware of what to look out for in case of heart attack.
Basically, heart attack is occur because of stoppage of blood supply to the heart. So it's a medical emergency. Most of the time patients have just burning chest pain or burning in the chest or just indigestion type of symptoms initially they can have. But most of the patients, they have classical anginal symptom, bilateral shoulder pain, chest pain, back pain, heaviness in the jaw. These are the typical symptoms. Some patients have nausea, vomiting, they can have extreme fatigue, and they can have shortness of breath, as already told. So most of the time heart attack symptoms can be varied. Some symptoms in male and female, they can be varied. So basically you have to initially judge if something abnormal is happening or something. First time you experience such type of acidity, you should consult a doctor, because that is more important. And you should get help. You should do ECG as soon as possible, and you should get admit in the ICUs. In India, most of the time after heart attack, the primary angioplasty is the best treatment, but because of scarcity of cath labs and cardiologists, most of the time thrombolytic injections can be given after heart attack, and life can be saved, and then you can have a angiography and angioplasty.
All right, Dr. Vikramaditya, if you could tell us also about, the fact that families who have a loved one who is suffering from heart disease, how important it is for them to learn CPR.
It is very important because, like we have discussed already, the panelists have spoken about it. The earlier the CPR is instituted, the better the outcomes are. And till the time help available, we have seen many patients, who receive a CPR and they turn out at the hospital. In many times, even say few seconds of CPR also can help. And more and more people in the public domain should be trained about it. Not only family members, even say malls, people at malls and all, they can be taught about CPR, and whatever they know, maybe just by CPR. If laymen are doing CPR, then chest compression itself is enough. In fact, the guidelines also recommend that, since everybody cannot take care of airways and all, so just chest compression is also enough, and they should be doing that.
Right. Dr. Singh, we also spoke about people in gyms knowing CPR. If you could also talk about how those who are suffering from some sort of heart issues or, heart disease, how important it is for them to keep that in mind when exercising.
It is very important that what exercises you can do. Better you consult with your doctor and take perfect advice that what category of exercise a normal person can do, a patient can do. So it is important to do exercise, but it is not to do excessive exercise. Because nowadays you are hearing so many things that someone is died of doing a treadmill and this and that. So it is very important. You should know that what capacity, what is the exercise tolerance of yours and your disease, and you should work out, run, play, swim, anything you do within the limits, otherwise it will be fatal for you.
All right, so very important to keep all this in mind. Well, thank you so much, doctors, for joining us on the program and talking about these very important issues regarding heart health and also awareness about CPR and not being a bystander in case anyone does have a heart incident. Thank you, doctors, and thank you all for watching at home. Goodbye.